Hello, everyone, and welcome to another edition of FitRx. I'm your host, Dr. Greg Dennis, and today we are going to talk about biological age testing. You may or may not have heard of these, but obviously we have our chronological age, which is our actual age, and then we have our biological age, which is basically what age our body is on the inside, if you will. There are a number of different biological age tests out there. And today we are going to talk about one in particular called GlycanAge. And I'm very excited about this. So I first heard about this test when I was at the Age Management Medicine Conference in Miami back in the spring. And what I liked about this particular biological age testing is it tests multiple different things, which we'll go through, but it gives you specific actionable things to do to improve each one of these parameters. And so I really like that because you can test, you can do these recommendations, and then take another test 6 months, a year down the road, and see what your results are. And I will say that my results were very skewed in a good way. And I was actually 30 years younger in my biological age. So I tested out at 20, which was kind of cool. Which makes me think all the things we talk about on this podcast are, they work. And so, but we are going to go through my test results, and that'll give you an idea of how this test kind of works and breaks down. And to help us do that, I have Paula, and I'm probably going to botch this last name, but Franekovic. Am I close there?
Close.
Close enough. She is a GlycanAge specialist. She has a Master of Science in nutrition, and is very involved in just the longevity. And I'll actually let her tell a little bit more about as far as kind of what she does in the company. So it's kind of a long introduction, but Paula, welcome to the show.
Thank you for having me. It's a pleasure to be the bearer of this wonderful news. Let me just say a few words about my background and what do I do in the GlycanAge company. So I am in a position of a GlycanAge specialist. So most of the people who decide to determine their biological age with the GlycanAge testing come to me, and I help them, we have a conversation, and I help them interpret the results, make sense of this complex world of glycobiology that is still very much exploratory and very new in the scientific community as well. I help them create their first steps to optimize their longevity journey. Like you mentioned, my background is nutrition science, but I'm trying to expand more and more into the whole longevity space to cover as much ground as I possibly can. And very excited to talk about your results, which, like you said, are exciting and extraordinary.
Yeah, no, very nice. Well, I guess we'll get started. First, let's just talk about maybe just biological age test in general. I would say in general, it's a pretty new science. And there's other tests that check for like telomere length and different things. But this one is a little bit different. And so I guess maybe talk about those other ones just very briefly, and then talk about GlycanAge, specifically what the heck are glycans and how this kind of checks for biological age.
Yes, that's a very broad subject, and yes, biological age tests are new. I would say that the first biological age tests were put to the public in 2013. That was the GlycanAge test, and it was the Steve Horvath's methylation-based testing. And from that, we expanded, and there's lots of ways to measure your biological age in this day and age. So the notion of biological age kind of scattered around a little bit. It used to mean one thing, but now, for example, your smartwatch can give you the biological age. So I know that a lot of people are quite confused about this, and they equate, for example, the biological age that you get from, for example, your diagnostic scale versus the one that you get from a biological age test. They are not the same. Sometimes you can combine a few of the tests to kind of get the fuller picture of your body. For example, there are also specific ways, specific tests for example, determining the biological age of different organ systems, for example, your brain health, your heart health, and so on. And they also are based on different biological bases and background, like you said. So you can measure the telomere length and in that way calculate the biological age. You can also look at your genetical factors. You can look at your methylation patterns. All of these things are an emerging science. So there is still not one consensus of what is the best and what we should look at first. It depends on your goals and it depends on what you want to achieve with the biological age testing. Let me try to explain the differences and how GlycanAge differs in this whole realm of biological age testing. In GlycanAge, we are focused on looking at your glycans in the immune system. And glycans are also one additional layer of complexity because they're also very new. So it's the science behind GlycanAge testing is based on glycobiology science. So glycans are actually specific sugars, very complex sugars that our body makes. And they are kind of the accessories to our proteins and our cell structures. So most of the proteins that are well known to us are actually glycosylated. So they have many, many glycans on their surface. One of the examples is, for example, collagen protein. Most of us are familiar with the collagen protein. However, in our body, this collagen protein is covered with a fuzzy layer of many, many different glycan structures around its structure. And if something goes wrong in the process of putting the glycans on top of this protein, it cannot function very well, and it can, make us age faster and make our skin look droopy and so on. So glycans kind of give us an additional layer to look for and to optimize if we are thinking about achieving a healthy longevity. And I'll talk more about specifics about the GlycanAge testing. Would you like me to do so now, or do you have some more questions for me before I dig into the specific details about the testing?
Yeah, no, I think that's good. Well, let's just get into specifically about the GlycanAge. So
yes, so in GlycanAge testing, like I said, we are focused on glycans, but we are focused on glycans on the immune system molecules. So what we do in this test is we take your blood sample and we isolate the immunoglobulin G molecules. This is the most abundant family of antibodies in our immune system. And they are very interesting. They have a rich, vibrant layer of glycans around them. And these glycans can either be created in a pro-inflammatory or an anti-inflammatory way. So by measuring those glycans, we can see if your immune system perhaps has some negative side effects is impacted in a negative way with the low-grade chronic inflammation process. And this is actually what separates the GlycanAge testing from other biological age tests, because we are so sensitive to determining the negative effects of low-grade chronic inflammation. And we know that inflammaging, so rapidly aging due to the negative effects of inflammation, is one of the newest hallmarks of aging. So it's quite important for us to map out the effects of this low-grade chronic inflammation process on our immune system in order for us to have a good handle on the overall aging process. This is still a new notion, and inflammation is something that is also kind of mysterious and hard to define these days. So I would say there are two main types of inflammation. You could have acute inflammation, which is actually beneficial. If you have an infection or a cold, your body responds with activating these inflammatory molecules to help you fight off that infection. However, in these modern times, we have problems with low-grade chronic inflammation, which can be an underlying silent killer, I would say. Throughout the years, it can accumulate, and it's typically asymptomatic until it's very, very symptomatic. And it's an underlying issue in most of the chronic diseases that ail us these days. So, for example, chronic inflammation is present with obesity, with type 2 diabetes, with chronic kidney disease, with all of these chronic conditions. So it's quite important to, put a number on this and follow it throughout the years and optimize before it's too late. Does this make sense to you?
Yeah. And so, what I like about these kind of tests is it's kind of quantifiable data that you have a starting point, you can make changes that are recommended, and then you can retest and see if what you're doing is working. So it's kind of a nice set of data, I guess, to have.
Yes, and this is also an important point. So glycans are changeable in a matter of 3 to 6 months. So your body, according to what you're doing in your lifestyle, if you're introducing new supplements, if you're introducing some new therapies, your body is going to make cues to attach different glycans. So it's possible to, for example, in a matter of 3 months, for your body to start creating more anti-inflammatory glycans, more protective glycans, and vice versa. It's a very good test to kind of measure the progress over time and the measure of the successfulness of the certain protocols. Whereas, for example, if you are doing the DNA test, you can do it once in your life. Epigenetic tests take a few years to have an effect. So GlycanAge is kind of in this Goldilocks zone if you want to test the impacts of your protocols on your immune system health.
Okay, well, very nice. Well, should we start going through mine, and then maybe that'll make, kind of explain a lot of things, I think, as we go through?
Yes, let's do it. I will share the screen with your results. Let me go. So this is an introduction. We already went through it, and let's show your results. So your biological age, according to GlycanAge, is 30 years younger than your chronological age. It puts you at 20. So what this means in the context of GlycanAge is that your immune system resembles more of somebody that is 20 rather than somebody that is 50, which is very beneficial. And it's actually the lowest that you can get. Our span is from 20 to 80. And the reason why 20 is the perfect number is because in adolescence, in our teenage years, our glycome does all of these crazy things, and a little bit of pro-inflammatory shift and pro-inflammatory molecules are beneficial because they make us grow. So when we are 20, we are full adults, so we can measure the stable glycome from there on. So this is quite a big difference between your biological age and your chronological age. What this generally means is that your body is very capable of producing the protective anti-inflammatory glycans. And this is very important because we can have a reduction in the production of these protective glycans with just natural aging, but this can also be accelerated with the impacts of chronic inflammation all around our environment. It can come through our diet and so on. So with this, in your current results, we are not seeing any negative effects of this. So typically people that are in this range are people with there are three main reasons, and typically they are combined why we see people in this very beneficial range. So typically we see people that have a good genetical background here, because 40% of the whole glycome is hereditary. So some of us are just genetically blessed to be able to be in this category. Some of us have more difficulties getting there. we see people who take really good care of their lifestyle and have a good handle on their environment, exercise, diet, sleep, and stress optimization. Those are kind of the four main realms of optimizing longevity. And we see people on certain therapies. Here, so most of the people that have a really good handle on their hormonal health, particularly testosterone levels, estrogen levels, progesterone in females, tend to be in this range. So we talked about this a little bit before, but just a brief comment on you. Do you have a good genetical background, or is this just your lifestyle optimization tactics?
Probably a little bit of both. I have some pretty good genetics. I wouldn't say I've got, any like centenarians in the family or anything, but most people live fairly long age, so, and obviously, I mean, I try to practice what I preach. And so, I do live a healthy lifestyle. So hopefully I got a little bit of both.
Yeah. Let me move on and describe further details. Other than measuring the overall biological age, we also group these glycans to form the glycan indexes. So we developed 5 glycan indexes according to their structures. First of the indexes is glycan shield. This is one anti-inflammatory index. And it's made of glycans that have sialic acid on top of the structures. This is very important because having a high quantity of sialic acid containing glycans is protective and anti-inflammatory. And if your body is capable of producing them, that means that you are capable of building the defenses that will help you fight off infections, detect intruders, for example, viruses or bacteria or a defected cell, and then alert the whole immune system to react in an efficient way. So regarding your results, here you are at the 99th percentile. So that's very beneficial. Just 1% of the population has better results than you. And that's amazing result. And typically people who have this high of a result describe themselves as very resilient to, for example, seasonal colds. They do not get sick very often. If they do, the symptoms are generally mild than the people around them. Would you say this is true for yourself?
Yes, I would.
Yes, so some of us can naturally be in this range, but some of us need a little bit of help, extra help from supplements and other substances in our diet to get here. So most of our research so far, and we need to conduct even more research to confirm this, but we know that majority of the supplements and nutrients that actually boost the immune system function tend to increase the level of these glycan shield protective glycans. So typically people who have a really good handle on their, for example, vitamin D levels, omega-3 levels, magnesium levels, and take some antioxidative supplements either from the diet, from various plant and vegetable sources, or from supplements, tend to increase the level of these anti-inflammatory substances. Anti-inflammatory glycans, sorry. It's been a long day. Can you tell me a little bit about your supplement and nutrition routine? I think we talked about this, but I think it's a true testament of your high result here.
Yeah, so it's interesting that everything that it shows are things that I preach, and so it's kind of cool to see that. Number one being protein kind of optimization, and I preach because I don't feel like most people get enough protein, so I try to I try to get a fair amount of protein in my diet. Vitamin D, if people on my podcast or certainly patients of mine, they know that I preach vitamin D, and in my opinion, it's probably the number one, supplement out there that I recommend. But you have to know what your levels are to know how much you need, is what I tell people. But yeah, so my vitamin D levels are where they should be. They're what I consider optimal. I will say for people listening, I mean, the normal, quote, normal for vitamin D is a huge range. I mean, anywhere from 30 to 100. And, you know, if you are at 30 or 31, you're in the quote normal range, but I would not say that's optimal. And so I like to optimize vitamin D. As far as other supplements, magnesium is another one that I take. And basically everything you mentioned. And fish oil. I think we talked about
Yes.
it at our first meeting that I did a little protocol with some high dose fish oil. So it would be interesting to me to know how much that affected, you know, these results, because I was on a pretty high dose, I think, at the time. But so yeah, I think fish oil is great, and so all of those I do personally.
That's amazing to hear, and I wish you could have tested before you started your fish
Yeah.
oil trial, so we can see how big of an effect we are seeing with this. And just to follow up on the vitamin D intake, I also agree it's quite important. And interestingly, the ranges of the reference ranges of vitamin D were, if I'm not mistaken, they were determined by looking at how much vitamin D we need for optimum bone health. However, when we look at the history of development of vitamin D receptors, they are also present in spineless vertebrates. So why would they have vitamin D receptors? And one of the reasons for this is because in those species, the primary role of vitamin D is immune system preservation, which is very interesting. And I think we are kind of rediscovering this ancient function of vitamin D. So I would say in the future, we may be redefining what the optimal range of vitamin D is. And what I see from practice, most of us need optimal and a little bit higher levels of vitamin D that is usually recommended. So very much important
Agreed.
for optimum immune system function, not only for bone health, as it's kind of the classical role of
Yeah,
vitamin D.
for sure.
Let's move on. We have another anti-inflammatory index here. So it's called Glycan Youth. It's made of also a set of anti-inflammatory glycans. They look a little bit different. They have different endings on top of the glycans. So these sets of glycans have two galactoses in their glycan structures. This is very important because this galactose binding capability is kind of the main event that's either gonna make or break our glycans. So if we have the capacity to bind the galactose on our glycans, they are going to be created in an anti-inflammatory way. If this capacity is lost, our glycans are going to be created in a pro-inflammatory way. And this capacity to bind the galactose can be naturally reduced with natural aging, but it can be accelerated with other environmental impacts. And one of the things that accelerates the loss of the galactose is improper hormone balance. And this is very important. And there are also other contributors. So for example, stress and high oxidative load is also going to reduce our capacity to bind the galactose on top of the glycans and make us age faster. And I know that this is something that we all kind of feel inside, but here we can actually measure it. And let's talk about optimal hormone balance first. This is important because what is very exciting is that a GlycanAge can actually determine in women when they start to undergo the change, the perimenopausal change, which is determined by the primarily reduction in estradiol levels. And this is followed by a reduction of the galactose binding capability. So in GlycanAge, I'm very excited to say that many of our clients are women in this that are starting to feel a little bit different than before. They are probably in their around their 50 chronological years. And I would say that this part of population is kind of the best biohackers because they're seeking answers. They do not feel great. They are trying to find out what is wrong with them, and they come across GlycanAge, and we can help them a lot and determine if the perimenopause onset is taking place, and then follow them as they go and try different protocols. Similar goes with males. So males also tend to reduce the levels of testosterone just naturally with aging. And this starts also around the age of 50, sometimes before, sometimes later. We can also determine the losses of testosterone here with the loss of the galactose binding capability. Like I said, there are also other factors that influence these types of anti-inflammatory glycans. But let's just comment on your results real quickly. So you are at a 96th percentile here, so very, very beneficial. This signifies a high level of the anti-inflammatory protective 2-galactose glycans. So what this tells me is that you have a good capacity to bind the galactose. This is a sign of a good hormone balance. And secondly, even if you have some oxidative stressors in your life, you have ways to combat them, either with your supplementation, with your daily habits, and so on. Do you have some comments about this?
Once again, it's nice to see that what I preach is kind of validated, on this report. And one of those being hormone optimization, which I feel is very important in just overall health and longevity. And there's many pieces to longevity as we're going through a lot of them. But one of those, a very important piece is hormone optimization. And I do that for myself personally, which I'm sure contributed to this based on what you're saying. And and once again, most people listening probably know this, but there's a difference in quote normal and optimal. And so,
yes.
What I've always liked to do at my clinic is we optimize hormones in men and women. And so we want to get them to kind of the more optimal levels. And so, I that's what I do for me, personally, which I'm sure affected this particular result.
So let me ask you, in your clinic, you do you have clients female clients that undergo the change associated with perimenopause?
Oh, sure. Yeah.
What do you typically, what do you typically measure?
So estrogen, testosterone, and those are the big ones. Sometimes progesterone, and then of course, we're checking thyroid. We're kind of checking all those things. But as far as hormones,
did you ever find some discrepancies? For example, hormone levels being still optimal, but the client not feeling so great, having trouble sleeping, gaining weight?
I'm sure we've seen that because there's so many variables involved in, what you just said. Stress, sleep, nutrition, all kinds of things. But certainly hormones are something that we want to once again optimize. So.
Yeah, that's very, very interesting. And lots of the clients that I speak with still say, particularly in the perimenopause stage, not like full-on menopause, but the period before this, which can last in some cases 5, even 10 years.
For sure.
Sometimes we can still see a good enough level of hormones, even optimal in some cases, whereas we are in the glycans seeing a pro-inflammatory shift related to hormone disruption. So it's a nice way to have a holistic view on that specific period of life and be more sure about the hormone replacement therapies and all of the other protocols to implement.
Yeah, it would be interesting to see on that patient that you just described if you went ahead and maybe put them on some hormones. If they're not yet menopausal, you wouldn't do estrogen, but for perimenopausal women, a lot of times we do testosterone therapy, sometimes some supplemental progesterone. So it would be interesting to see just that, doing that, what it would do, the change that it would make for this specific, glycan.
Yes, from anecdotal evidence, I can tell you that it typically increases the level of glycan-used glycans. But still, lots more studies needed to be conducted to confirm this. But yeah, the picture of an increase in the anti-inflammatory glycans follows a more beneficial feeling in the body of the clients. And I like that you are starting with testosterone, because some of the testosterone can be converted to estradiol if needed in those cases. Okay,
Yep.
nice. I will move on to describe another glycan index. This is called the glycan mature index, and it's a set of pro-inflammatory glycans, like I mentioned. So if we, for some reason, lose the ability to bind the galactose on our glycan structures, our body is over time going to start to accumulate the pro-inflammatory structures, pro-inflammatory glycans on the surface of immune system molecules. And this is not a beneficial event, and we want to do everything that we can to reduce the level of these pro-inflammatory glycans. And you are doing just that. So you are at the first percentile, so very low level of the pro-inflammatory glycans. This is also related to hormonal health. So I would say that we are also seeing the consequences of good hormone balance in your case. But we also see thyroid hormones and cortisol are specifically drivers of this. So sometimes the increase in the mature glycans can be independent of for example, glycan-used or glycan-shield glycans. We see specific cases where only the glycan mature structures are elevated. This is sometimes seen in people who have, for example, problems with thyroid health, problems with controlling their stressors throughout their life. So they have an overall higher average of cortisol, which is also something commonly seen in perimenopause and menopause. But here I have nothing else to add. Sometimes we also see that some fasting protocols can reduce the level of the pro-inflammatory glycans. Do you have any comments on this? Did you, for example, experience any benefits from fasting in your clients, in yourself?
Yeah, I think it depends. I used to really encourage a lot of fasting, and certainly those that are struggling with insulin resistance or they're diabetic and they're overweight. I think fasting can be a good tool to help improve an overall metabolic health. I think for others like myself, I used to fast. I just because it was supposedly healthy, but I have a fair amount of muscle. I have a pretty fast metabolism, and I feel like that I was almost kind of stressing my body out,
Yes.
more than what I was, doing good. And so I still do it occasionally, but not near as often as I used to. And so I think it just depends on the person. I will say one of the tips that I see on this one is to consider caloric restriction. And I probably am in general, and I don't necessarily do this on purpose, but just day to day, I probably don't get quite enough calories, which I guess maybe in this case it helped. I don't know.
Yeah, we cannot be sure what, because there are many factors that you are doing, and many of these protocols and supplements and therapies and everything. But I agree with you that with fasting, we need to be careful. And sometimes if fasting is done too much, we are going to see reductions in lean muscle mass, and this is actually what we do not want to be seeing, because lean muscle mass is one of the elixirs of youth and predictors of longevity. So we have to be careful to balance this out. When talking to clients, we get a lot of people that are very proactive about their health. So we had a trend recently, I think it was a year ago, of over fasting in some of our clients. And what we did is actually we saw an opposite effect. So we see an increase of the pro-inflammatory structures. particularly when this over-fasting was done in a combination of cold exposure, over-exercising, focusing on caloric restriction. And when all of these things are combined, we can become very catabolic. So I would say we need to consider the balance of anabolic and catabolic pathways. And if we achieve this balance, I think we are on the right way to achieve a healthy longevity. However, the trends that are coming out can skew us on one side or the other. Before being very catabolic, we had a trend of being very anabolic with testosterone over testosterone therapy use and with extremely high protein levels and so on. So I would say balancing all of these factors is the key.
For sure.
Okay. So glycan median, I'm not going to spend much time on talking about this index. This is a supportive index. And it's kind of a set of transitory glycans between the glycan youth and glycan mature. It's important to be around the 50th percentile here because this can give us an information of is your body still capable of even binding one galactose on the structure or not. In your case, you are slightly below this average. But I would say we do see it sometimes when people are, just at the very high ends of an anti-inflammatory spectrum. Your body just has what it needs, so it doesn't need to produce any extra things. However, I would be worried if your levels were extremely low. This can sometimes be seen in people who are at a high risk of developing cardiovascular issues. So this is where we would recommend, for example, checking the blood pressure, checking the lipid profile, checking the classical cardiovascular risk factors. Sometimes this can also be seen in people who have a family history of cardiovascular issues. And I think this is where the saying, genetics loads the gun, environment pulls the trigger, comes into play. And like I said, 40% of the glycom is hereditary, and in some cases we see just a naturally reduced levels of glycan median due to the hereditary functionality of the glycans and the family history of particularly cardiovascular diseases. Do you have comments or should I move on?
Yeah, no, you can move on. That was, I guess, probably the only one that I didn't score like really high in. So I don't know why, but
yeah, I would say that this is where potentially the statistic comes into play because you are an outlier, very, like you said, very positive outlier. So we have to consider this and always look at the bigger picture of the glycan. So otherwise, your profile is very anti-inflammatory. So I would also take into account if it's not that. So, for example, if your biological age was elevated, then your glycan median was at this stage, I would be worried, and I would recommend some cardiovascular specific tests.
Gotcha.
But yeah, overall, you are quite protected.
Okay.
And let's talk about the glycan lifestyle last. So this is also a supportive index. It is made of a specific set of glycans that have bisection in their structure. And these sets of glycans are not so much dependent on the chronological passage of time. They are more of an indication of our daily habits. So sometimes we can see people with very high, negatively high levels of this glycan lifestyle who still have a good biological age and vice versa. And I can tell you that typically people at very high levels of the glycan lifestyle are smokers, heavier alcohol drinkers, people who eat a diet high in ultra-processed foods, or people who have certain respiratory issues. For example, either they have a family history of respiratory issues, they recently had a respiratory illness, or they are exposed to some pollution from the environment. So, for example, sometimes we have people working in construction that have elevated levels of glycan lifestyle because of the dust that they inhale. And still, much more research is needed to confirm all of the environmental factors that could increase the level of the bisection glycans. And typically, I can determine who is a smoker with this index. They can still have an overall good biological age, but they cannot hide this particular habit from glycan lifestyle index. In your case, you are at the 58th percentile. This is in the green, and it's an average score similar to what they have a population. Sorry, I messed up the saying, but yeah, your result is average. And we want to have it a little bit lower. So here, the main contributors, if we eliminate, so I would say you're not a smoker, not a heavy alcohol drinker, not all of these things I mentioned, because your score would be much higher. However, we also recently did a study showing that high stress loads and reduction in sleep quality can also increase the level of the bisection glycans. We still don't know what the mechanism is. And interestingly, here we also saw a study recently that increased level of omega-3 supplementation can reduce the level of glycan lifestyle structures. And you did an experiment, so it's a little bit of a puzzle of why you are above the 50th, slightly above the 50th percentile here.
Yeah. Well, I can tell you for me, it was stress. And so I wonder if I wouldn't have done the omega-3, if it might have not even been higher. I think I shared with you before that I was, at the time I took this test, I was going through a very stressful time in my life. And so I actually was very surprised by the overall outcome, because due to high stress, I thought it might be kind of bad, but overall it was good. But with this particular one, I'm sure that it was the stress that causing this one. So
yes, this is something that we often see, and it makes my job a little bit difficult, because advising somebody to take better control of their stress is a very difficult thing to do. But sometimes I see, and sometimes when we try to conduct studies, for example, in a few of the cases, we had outliers. So what we wanted to do is implement certain therapies, certain protocols, and see how GlycanAge behaves. And in some of the studies, we did have outliers that got worse results after the certain protocol implementation. So when we went out and did interviews with them, it turns out that they were going through a very difficult period in life. For example, through a divorce or a loss of a loved one. So it's also very interesting to consider this emotional and mental layer, which contributes greatly to inflammation load, which is going to negatively impact the glycans and the immune system health. And I oftentimes see people that have a particular pattern. So they have increased level of pro-inflammatory glycan mature glycans and decreased level of glycan-nude glycans. And I call this the manager's profile, because it's so commonly seen in people on higher positions, very stressful positions. And it's an indicator of negative influences of stress and mental load on the immune system function.
Gotcha.
Yeah, so we went through everything. I still have the beta version of the report with the diseases of indication. We can talk about this a little bit if you want. We can also talk about other stuff, whatever you decide.
We're getting close to time here, but I mean, if you want to go over the beta report just briefly and kind of the relevance, I guess, of that.
Yeah, so like the name says, it's in the beta version of development. So what we try to do with this additional report is provide additional value that is particularly important in medical professionals. So we are collaborating with lots of longevity-oriented clinics and clinicians, and we are continuously conducting studies on the relationship between the glycoprofile and your risk of developing a certain disease and condition. So what we try to do with this beta version of the report is determine your unique glycan fingerprint and overlap it with the cases where people had or ended up developing these diseases and conditions listed here. Some of them fall into a category of cardiovascular diseases. We have autoimmune diseases, metabolic diseases, respiratory diseases. We have more data to for a lot more diseases and conditions, 72, I think. But for this beta version, we decided to focus on the most common ones and the ones that we have the most data points for. This is still in the beta stage of testing, but it already is showing to be beneficial and valuable for the clinicians that work with us. For example, most commonly for rheumatoid arthritis, what we discovered is that the overlap of the glycans in rheumatoid arthritis is very specific. So if I go to this page, so a person that could potentially have a higher risk of developing rheumatoid arthritis would typically have, at the same time, increased glycan mature, decreased glycan median, decreased glycan youth, and decreased glycan shield. So overall, a glycoprofile that is shifted heavily towards the pro-inflammatory side with a loss of these natural defenses. And we also, we have the most studies is done on rheumatoid arthritis so far. And what we also showed is that this pattern of very specific pattern in the glycans can be seen sometimes 10 years before the full symptomatic full symptoms development. How would I don't know how to phrase this, but they seem to be the glycan patterns seem to be one of the predictors of rheumatoid arthritis development. Which is very interesting. And of course, it needs to be combined with other factors, family history, biological sex, also other factors, for example, rheumatoid factors and all the other rheumatoid arthritis specific blood tests. But it gives us an opportunity, if we are able to catch this in a very early stage of development, it gives us an opportunity to develop personalized specific protocols to prevent this future from taking place, which is very exciting, but it's still a long way to come and to implement this as a potential diagnostic tool. Just briefly here, we see no significant overlaps with your glycoprofile and most of the diseases and conditions mentioned here. We only see a minor overlap with COPD. That's a pulmonary set of pulmonary diseases. If I go to this page, you will see that oftentimes people with low level of glycan median and high level of glycan lifestyle, this is commonly seen in people with respiratory distress and respiratory problems. And the only reason why you overlap is your overall lower glycan median. I asked you before if you have a family history of pulmonary diseases, and you said no. But no. This is just a minor overlap. So we are still trying to discover what this would mean. In most of the cases, I would say, well, of course, pulmonary distress can mean a lot of things. What I discovered anecdotally is that focus on more cardiorespiratory training, strengthening the lung capacity, typically does the trick, and all of these other lifestyle changes that we can do in this preventative realm to potentially address this minor overlap. So I would say this is an indication to focus a little bit more on the respiratory health, potentially find even environmental disruptors that could be contributing to this, but it's not relevant enough for me to recommend follow-up tests like a chest X-ray or something like that. Sure. So it is an area to keep your eye on as you move along. And that's basically it for the glycan insights. Yeah, do you have some more questions or comments about?
No, I think that's great. It's very interesting stuff. If people are listening and they are interested in getting one of these tests, do they need to go through a provider like myself, or can they order these directly?
They need to go through a provider at the moment, because this needs to be looked at from from the eyes of a medical professional and triangulated with other clinical data as well.
Okay, gotcha. And for those that are listening that are local, I have considered, getting some of these tests and ordering them. So if that's something you're interested in doing, just reach out to my clinic. For those that aren't local, how would they go about finding a provider that could work with them on this?
Yeah, that's a good question. So you can contact us directly from the GlycanAge website, glycanage.com, and we have a team that is very hands-on and can help you find a practitioner in your area or help you connect with us, so we can talk to you and see what works best for your individual case.
Sure. Okay. Well, very, very interesting stuff, and really appreciate all that information and you going through that with me and my results. And I guess as we wrap up here, I always ask my guest if they could give us one health tip that would make us healthier today. What would you say to that?
I was
Putting you on
not
the spot
prepared
here.
for
I'm
this.
sorry.
Yes.
Yeah, sometimes it's hard to just pick one, but
Yes. Oof. Well, I recently read a study that loneliness can be detrimental. This can cause the same detrimental effects as smoking. So it's very interesting in these modern days that we also tend to have a pandemic of loneliness, especially after the COVID-19 pandemic. So I would say one of the tips is try to connect and reconnect with your friends and family once per day, and it can help you, live longer.
Oh
We
yeah.
have now studies showing this.
Great answer. Yeah, no, that's great. So, well, thank you so much. I'm just going to say, Paula, I won't botch your last name again, but for those interested, again, you can go to glycanage.com and I'll have that in my show notes to find out more information or reach out to me. And certainly appreciate your time and appreciate everyone listening. And we will talk to you next time.
Thank you for having me.